The average American is no stranger to medication. In fact, 66% of all U.S. adults use prescription drugs, according to Georgetown University's Health Policy Institute. And though there are thousands to choose from, there are only two types of prescription medication. The first are brand name products. These drugs are manufactured and sold by the same company that holds both the patent and the new drug application licenses from the FDA.
There's another type of product called generic drugs. And those products are sold by companies that face competition, and they hold abbreviated new drug application license from the Food and Drug Administration to sell their products into the US. Branded drug manufacturers actually charge very high prices for their products in the US. And in fact, the US is both the largest market for those branded drug products, but also we pay the highest prices for them.
That's Dr. Rena Conti, Associate Professor of Markets, Public Policy, and Law in the Questrom School of Business at Boston University. She says the high prices of brand name products help make generic drugs more appealing to consumers, especially those who take numerous and expensive medications. And though off-brand, this medication must meet specific criteria, like utilizing the same active ingredient, strength, and type of product as its branded counterpart. The FDA also requires off-label drugs to operate under the same strict standards as the brand name ones. This security has aided in the popularity of generic medication.
Approximately 90% of total sales of prescription drugs in the United States are generic.
And though the FDA is clear about prescription medication regulations, one area is kept hidden. The manufacturing locations of generic drugs are commonly held as a trade secret.
There are longstanding economic questions about where certain products are made and what are the determinants of that. We were particularly interested in that question as it relates to the prescription drugs that people take in the US, because the most commonly used medical care in the United States is actually prescription drugs. And very surprisingly, many of the drugs that people use every single day appear to be manufactured by many different companies, are actually in short supply or have experienced quality deficits over time.
So Conti, along with a team of researchers, set out to discover where these products are being made and how that location might contribute to supply chain challenges. Her 2021 paper, published in the Journal of Law and the Biosciences, focuses on generic drug production. It's widely known that branded medications mainly operate within the U.S., but Conti says the generic market is a whole different story. While we can purchase generic drugs at a lower cost, she says it comes at a price.
Up until very recently, the label on the product that we get from the pharmacy would not necessarily tell Americans where those products were made. And that meant that consumers and pharmacists and doctors couldn't actually check and couldn't actually shop differently if they wanted to, or buy American if they wanted to.
Conti says now many manufacturers voluntarily list where the final drug product is made on the prescription's label. Unfortunately, the information is not mandatory, and it doesn't reveal where the base active ingredients are made. That information is still protected as a trade secret. The FDA defines trade secret information as any commercially valuable plan, formula, or process that's used to make products. For generic drug companies, the trade secret is where their raw ingredients are sourced and the location of production. And though Conti says the U.S. prescription drug market produces some of the safest and highest quality medication, she worries this trade secret could pose some issues for consumers.
What I have been concerned about is that there appear to be some significant challenges with transparency. Most notably, American consumers can find out where their food is made, where many other things that they use every day are made, and who they're made by. But the US consumers don't actually know who are making very intimate, important consumer products that keep ourselves well, prescription drugs. And we can't shop for quality here because we really don't know where these products were made and by whom.
Which was the driving force of her recent paper. Her team submitted a Freedom of Information Act to the FDA that gave them access to proprietary, non-public data. The information allowed them to evaluate where both the base ingredients and finished products were made, leading them to two main findings.
The first is that the majority of fill and finish, those are the actual drug pills, if you will, are made in the continental US and supplied to US pharmacies, although that manufacturing has increasingly moved overseas.
Conti says that there are three vital components to every prescription: the base ingredients, the fillers, and the final assembly process. Currently, 50% of the fillers and final products are manufactured in America, but that percentage has been on a downward trend.
Secondly, we find that approximately 80% of the base ingredients of generic drugs are being manufactured overseas. And actually, that percentage has been increasing over time. And here, what you should think about is these are the base ingredients. They're active. They're the things that drug companies gather and use to ensure that their final product delivers the clinical effect that American consumers expect from taking these products. Those products are largely made in India and in China, and increasingly so.
According to Conti's research, a main reason for the offshoring is due to cheaper labor and manufacturing cost. This incentive isn't unique to the pharmaceutical industry. However, the concern that comes with offshoring prescription drug production is the risk of interruption. If a political or environmental threat occurs that halts production, Americans lose a majority of the active ingredient providers and nearly half of all generic prescriptions.
Unlike other types of consumer goods, this trend in overseas manufacturing of base ingredients is relatively recent. In other words, we can see a notable intake in the offshoring of manufacturing to India and China that largely starts to occur in the late 2000s, early 2010s.
However, Conti says the biggest concern relates to FDA inspections of those offshore sites.
It's hard to inspect. It's costly to inspect. Manufacturing plants located in very far-flung places. And those increased costs can lead to two effects. The first is that all plants are inspected. And if so, not all of those plants are inspected potentially to the level of detail that one would expect or is common in domestic manufacturing inspections. And secondly, that it can just simply take a long time to inspect each and every one of these facilities. And the second effect is if you're a manufacturer that knows that inspections may be slightly weaker or not have the periodicity that they do in the domestic market, you may face stronger incentives to cheat.
Conti says the U.S. market has already seen quality lapses, mostly due to these manufacturers not adhering to the FDA's standards.
Quality failures in some of the Indian plants and some of the Chinese plants were in products that people use every day to manage their chronic disease, such as diabetes, HIV, depression. And so when those products are not manufactured to safety and efficacy standards and they enter into the US supply chain, that is really a fundamental failure of both these companies to adhere to the social compact and do the right thing. But also, frankly, it's a failure of authorities to protect the US public.
In 2010, the pharmaceutical company GlaxoSmithKline pled guilty to charges of contaminated medication produced over the course of 5 years at a Puerto Rican facility. The tainted drugs included a popular antidepressant and medication for type 2 diabetes. And though these failures can be devastating, Conti reminds us that they are far and few between. The relatively rare nature of these issues is what makes them so significant whenever they do occur. The FDA's requirements are among the highest standards in the world. Conti says Americans should feel safe buying and consuming prescription medication.
Although these examples are scary, in general, the US prescription drug market is quite resilient to these supply challenges and also to these quality deficits. It's actually one of the reasons that these failures that I just enumerated are stunning is because Americans aren't used to having drug products that are low quality or not what they say they are or unsafe. We actually enjoy the safest, most assured quality market for these products worldwide.
Conti credits the companies for investing significant effort and funds, as well as the FDA's oversight for this quality assurance. Her research aims to increase that trust even more through industry transparency.
Our system works actually quite well, and we shouldn't want to remake our system wholeheartedly. Instead, we just need to be careful about these trouble spots.
You can find more information about the FDA standards and guidelines, as well as Dr. Rena Conti and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. This segment originally aired in August 2022. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.